Hi, everyone. Welcome back to another episode of the Healthy Chicago podcast. My name is Janna Kerins, and I'm your guest host today. I am a veterinarian and an epidemiologist here at the Chicago Department of Public Health, or CDPH, and I lead the Communicable Disease Program. So what that program does is tracks diseases and also tries to prevent them that are associated with things like food, animals, or what we call vectors. So vectors are arthropods. Those are little things like mosquitoes, ticks, or fleas that can spread diseases from them to people. And today we are going to talk a little bit more about a type of vector-borne disease called West Nile virus, as well as some other mosquito-borne diseases. So with me today is Claudia Blanco, who leads the vector control program here at CDPH. Claudia, can you introduce yourself?
Hi, Janna. My name is Claudia Blanco. I work with the Chicago Department of Public Health. I've been doing vector-borne prevention for about 20 years now, and I'm happy to be here. Thanks.
And Claudia is truly our mosquito expert here at CDPH and loves to talk about all things flying insect. So, Claudia, I have been hearing on the news over the past few weeks that mosquitoes here in Chicago have tested positive for West Nile virus. And I wanted to just start out to ask, what does the city actually do to prevent mosquitoes or West Nile virus?
Yes. So our program is about 20 years old. And what we do since we started this program is all about prevention. We want to make sure we can reduce the mosquito populations before they actually emerge and cause a problem. And a lot of people don't know what we do. And part of what we do in our program is larviciding. And larviciding is treating catch basins in the public way. And the city of Chicago has over 210,000 catch basins. And of those 210,000 catch basins, the city treats about 90,000 every spring to reduce the mosquito population. So we have a very robust program.
And can you tell me, just because I feel like I always get confused about this, what exactly is a catch basin? Is it the sewer? Is it the storm drain?
Right. So those catch basins are the sewers that run along the side of the street. There's usually about 6 per block in a standard city block, but sometimes there's more or less, and they usually have a round cover, the older ones, and the older ones have a square cover. So it just depends where you are in the city, but we have about 210,000. And in those catch basins, if you were to look in, all the way on the bottom, there's stagnant water. And that's where the mosquitoes like to breed. They like to lay their eggs in that water because it just happens to be a perfect spot, a perfect area where there's just enough organic matter they can feed on, dark enough and not bothered, so it's a perfect place. And we have about 210,000 catch basins, which can be a really big problem, which is why we do this huge effort to larvicide them before they emerge into adult mosquitoes in the summer.
So can you tell me a little bit more about what larvicide actually is? What does that mean to do larviciding?
Right, yeah. So,
and I understand you brought some traps.
Yes. So what we do is, and this is really high-tech stuff, so we have this water-soluble pouch that we drop into the catch basins, 1 per catch basin, sometimes 2, depending on the product we use. And then this dissolves quickly, this pouch. And then what's left is this granular product that stays in the water for about 100 days. And when it is exposed to larvae, which is the second stage in the mosquito development, the mosquitoes, by either touch or by consuming, are affected by this insect growth regulator, so IGRs. And once it is exposed to this, it is unable to go to the next level of life, which would be to either the pupal stage and or the adult. So we kind of stop it there, right? So we completely stop the life cycle of the mosquito every time that it is exposed to this product. And this product lasts about all summer. The goal is to treat it once and have it take care of us all summer. If it rains heavily, yes, those mosquitoes can be, any mosquito there could either be washed out and the product can be lost, but then we go back and we check the basins all summer long to see if there's anything growing in them. So we're constantly checking the catch basins all summer long till about October 1st.
Okay, So we have these little pouches that we use, and we're trying to prevent the little mosquito larvae from growing up into adult mosquitoes. But, I live in the city. You live in the city. We all know there are mosquitoes. I tend to attract them no matter what I do. So I know that this isn't perfect. So then what else is the city doing? So we have these mosquitoes out there. How do we know if they actually have West Nile virus?
Right. So once we do that first step of larviciding in the spring, we move on to our second component of our program, which is trapping and testing. So in the city of Chicago, we've placed over 80 mosquito traps to try to cover the entire city so that we can get an idea and sample of what mosquitoes are out there. So once we collect those mosquitoes every week, we test them weekly. So we run these traps Monday through Wednesday with 2 nights of surveillance. And then on Thursday and Friday, we test them in-house in our lab using PCR and testing them for West Nile virus, St. Louis encephalitis, and I think that's the only 2 we're doing this season. Yeah.
Yeah. Okay. So, all right. Well, I think a lot of people probably do not know that there's ways you can actually trap mosquitoes. So that is pretty interesting. So we're trapping these mosquitoes, and then we're testing them for West Nile virus. And I feel like a lot of people might know what PCR is from COVID days. You think of PCR. We're not drawing blood from little mosquitoes, but we are testing them to see if they do have this, if they do have this virus in them. And then what do? We find out that the mosquitoes might carry West Nile virus. Does the city then do anything about it?
Right. And I think the city's approach is very conservative, but I agree with it very well. So what we do is once we test the mosquitoes and they do come out positive in a certain trap, our protocol is to 2 weeks of positive trapping. So that trap has consecutive positive for 2 weeks. And if the vector index is greater than 1, and we can talk about the vector index separately. But once, based on what we use to determine the vector index, and if it's greater than 1, then that's our protocol to spray. So a trap is positive for 2 weeks in a row, and it has a vector index greater than 1, then we spray in that area. And we do targeted spraying, right? What we want to do is once we find it, we want to eliminate it as fast as possible from that area. We don't want to spray, miles and miles of the city. We want to make sure we try to get it quickly and fast. Yeah.
Yeah. Okay. So a couple of things there. So, right, you mentioned the vector index, and I think it's kind of important to say that this is a piece of data that the city uses. It takes into account how many mosquitoes are in a trap, and then also what proportion of them are testing positive for West Nile virus. And that is something we use to determine when to spray. Now, you mentioned spraying, and, I guess, I have young kids, I have pets, my neighbors have
too.
Pollinator gardens. So can you tell me a little bit more about
Sure.
the spraying? Is this something I need to be concerned about if it's happening in my neighborhood?
Absolutely. So there's 2 things with that. The first one is when we do decide to spray, it is based on that protocol. So like I said, it's very conservative. We're not just spraying on the first spray. So that's one thing what the city does. And then what we do is we try to use a high-end product. And by that I mean a adulticide, which is another word for spraying or that fogging, but that is environmentally friendly, that breaks down quickly in the environment and has no residue. So we're always looking for these high-end products because we spray so little, we are able to focus on getting a very good quality product. And then we spray what's called ULV at ultra low volume. And by that, it means is that we dilute the product so much. We want to remind everybody that we're just trying to kill a tiny little insect, a little mosquito. So we don't need product that is extremely potent when we can use it at ULV rates. So with all that into consideration, that's when we decide to spray, and we use a product that's very high-end and easy on the environment.
Okay, so on the flip side, I have someone down the block that has a swimming pool. I'm not 100% sure that it's always taken care of. So, will the city come out and spray if there are mosquitoes? Does every mosquito carry West Nile virus?
Right. Not every mosquito carries West Nile virus, and there's a lot of mosquitoes that we call nuisance mosquitoes. So after the rains, we get a lot of the species of mosquitoes, Aedes, that is just a pesky day biter, but they are a nuisance mosquito, so they don't transmit disease, but again, they are a nuisance. So we don't spray for nuisance here as we are the Department of Public Health. But you mentioned a pool and people with who just kind of neglect their pools, whether it be above ground or even a kiddie pool, you can call 311 and report that stagnant water. And our team will go out and investigate, conduct a stagnant water inspection, and work with the owner to either eliminate the pool, drain the pool, or just get rid of that standing water source. And that's something we do all summer.
Okay, so we have a couple of things. So no spraying for just the mosquitoes that seem to love to bite me. But if there is, actually standing water, if there is an issue, then the city can come out and actually do something to help. I think maybe the big question here is like, okay, well, what do I do myself? I don't want to get West Nile virus, right? So how can I actually protect myself from mosquito bites?
So mosquitoes are attracted to three things. It's just our body odor, what we exhale, which is CO2, and our odor. So those are the three things they are attracted to. So remembering that, we can do a couple things to protect ourselves. I know it's hard. Oh, wear long sleeves on a summer day. That is difficult to do. I get that. So use repellent. And the CDC recommends 3 types of repellent, either repellent with DEET, Picaridin, or oil of lemon eucalyptus, which the third is my favorite. And you can also make sure that if you are going out during the hours that they're biting, which is at dusk till dawn, to really put a little extra on there. Then, it's good to wear it all day because there are day biters, but we really want to focus on that. If you're going out at nighttime, 1 hour after the sun sets, that's when they're going to come out to feed, and at dusk. So making sure you're wearing at dawn and at dusk, if you're out during those times, that you are protected by using repellents. There's things you can also do around your home. And that's a key factor. A lot of people tell me, I am just breeding mosquitoes everywhere and I can't get rid of them. I can't step out onto my deck or my yard. Well, let's find out if you're breeding them. Just go out to your yard and check to make sure you don't have any standing water, stagnant water. And you're like, well, where could that possibly be? Well, do you have any kiddie pools? Do you have any cups you've left outside during a barbecue? Maybe you left it on Friday, and by Monday they've got this stagnant water in there, and they can lay their eggs in the smallest amount of water, including our cups. Something the size of this cup is they're able to breed in. I just found some in the cover of our cooler. So my husband turned it over, and there was water, and it was left over the weekend. I went to check it. I saw the water, and yes, it had larvae in it. So I turned it over right away. I think in Chicago, it's also very important to check our gutters. So the gutters are a huge part of breeding mosquitoes. Why? Because the stagnant water that has stayed in the spring and the leaves that have remained over the fall and have kind of crunched up into that gutter is a very welcoming spot for mosquitoes to lay their eggs. They love the gutters, and a lot of people are not cleaning the gutters. So sometimes they're like, well, I got rid of all the standing water. I don't have, my bird bath is cleaned. I have a water fountain that's battery operated, because that's what I always say. Make sure that if you do have a bird feeder or a fountain, that it's pushing water, because mosquitoes will not lay their eggs anywhere where the water is flowing. So making sure those are on, making sure your gutters are clean, and making sure that that you've checked all your windows and making sure there's no cracks that they can get in. Mosquitoes are able to get in, because they are able to get in the smallest little spots. Yeah.
Okay, so yeah, I had an issue this weekend too, where my son has a toy grill, and there was like a small pool of water, and I was picturing you in my head when I emptied it out and scrubbed it out. Yeah. So yes, for people with kids, do think about kind of emptying those toys, other things that are carrying standing water, scrubbing them out once a week. I know we also have rain barrels, and we had some issues with those as well, so making sure those are emptied and cleaned out once a week, anything that can really carry water. And then at the end, you mentioned kind of controlling mosquitoes that can get inside. And so... Yeah, so that's right. So screens, so mosquitoes, like Claudia was just saying, like they can really get through those holes in the screens. And there's ways you can either repair screens yourself. You can get those little kits at the hardware store. You can, of course, replace your screens if you can do that.
Yeah.
Use your AC.
Yeah,
But
use the AC. And sometimes I understand that you're not able to fix it, or it's not your home, you don't own it. A small piece of tape will do it. Just a little Scotch tape, any type of tape, just seal it in the meantime while you work with your landlord or try to get something yourself to fix for your home. It's just try not to get them in, because they've sensed you. The moment you step outside, between 25 to 35 feet, the mosquito outside, he's already sensed you. They know you're out there. I don't see anything. They know you're out there, and they've sensed you. They can track you, and that you're food to them. So of course they've seen you way before you see them, they've already got you tracked out. Yeah.
This is good to know. I really do feel like I am somebody that definitely attracts the mosquitoes in my family. And then, so I have young kids too, and I know there's things like, I think our stroller, when we first got it way back in the day, came with that mosquito netting. Is that something
nice.
you can also put over like a stroller for
I would put it over, and I also spray. When I had a stroller, I would spray repellent on my stroller.
Oh,
so and I spray the net, the little cover, and then just like
not
extra.
On the kids themselves.
Not on the kids themselves. And it's the same with repellent. You can also put it on the clothes. You don't necessarily have to spray it on your skin if you don't want to, or you have sensitivity, or you have eczema, some type of allergic reaction. You can spray your clothes, and I recommend it. You can spray your pants, your socks. The whole point is to create a barrier, right? And for you not to be attracted to them. So if you don't have anything on and you're just exercising, let's say, you are going to be much more attractive for me to go bite than for someone who's wearing some repellent. It's easily going to deter that mosquito and turn its whole on you because you are not wearing anything. You actually smell good, you look good. So I'm going to come and take I'm going to take a blood meal, and that's why it's important to wear the repellent. Use repellent.
I'm sure I smell delicious when I'm running. Glad to know that a mosquito will love me.
Yeah.
I think in terms of kind of insect repellent, as you were mentioning before, there's really a couple of different kinds, right? So you can use a low percentage of permethrin to actually treat your clothes, as you were saying.
And there's clothes that are even treated now. You can even buy them online.
Exactly. Yeah, you can find them online and buy those permethrin-treated clothes. And then there are these kind of additional insect repellents that you can get, and those are the things that you can actually spray on your skin. You don't want to put them under clothes, but you spray them on yourself.
You can spray them on yourself. I have seen lotions come out now. There's different lotions. There's there's actual sheets that you would wipes that have DEET on them. So there's many things. There's bands. And the thing with the bands is if you're going to wear a band with repellent, make sure you put it everywhere, not just your arm to protect you. Make sure either you wear a lot of bands or just wear repellent, because I find those to be treatment. That's the only area it's going to protect.
Oh, it's more
so they're
localized.
Not going to localize. Exactly. Yeah. It's only going to be there. So might as well I still wear the traditional, either spray or lotion.
Yeah, me too.
To get coverage. Coverage. I think the bands are great, but you will have to wear several bands.
Okay, got it.
Yeah.
Okay, so lots of bands. But I do think it's important for people to wear an EPA-registered insect repellent. So those ingredients that you were talking about before, there are a couple of other kinds that are out now too. You can find them on the CDC's website. On the City of Chicago, we have them listed on our website as well. And then you always really want to follow those label instructions, especially for the kiddos. I have a kid under 3. There are certain types of insect repellents that, I will not put on him. So you got to make sure that you're really looking at that and making sure that you're using them correctly as well. So we talked a bunch about West Nile virus, but I did also want to say, for people that are curious about what are symptoms of West Nile virus? What actually do I do? So the vast majority of people who get West Nile virus, which you typically get from the bite of that infected mosquito, the vast majority of people actually do not develop any symptoms. So about 2 in 10 people who have West Nile virus will develop symptoms. Most of those actually develop just a fever and kind of flu-like illness. But there are a small number of people, so about 1 in 150 people who really do get truly sick. Typically, they are getting what's called encephalitis or meningitis, so inflammation either of the lining around the brain or the spinal cord, and that can typically result in needing to go to the hospital. Unfortunately, there are a certain number of people, I think about 1 in 10 of those who get really sick that will actually die from West Nile viruses too. So I think that is why we're really stressing this is how you can protect yourself from West Nile virus. And truly, this is the season for mosquitoes. So in Chicago, we do have those mosquitoes.
We've seen an increase. We've already seen positive pools in Chicago. The state already reported its first human case. So we know we're having an earlier season, and we never know what's going to happen with vector-borne diseases because we're so weather-driven. So depending on how the weather is, that just kind of determines what kind of season we're going to have. So Culex mosquitoes, the ones that spread West Nile virus, they are dry. So it's hot and dry. And so a lot of people think of rain and, of course, all those mosquitoes. But like I mentioned, those are nuisance mosquitoes. But I get worried when I see 4 or 5 days of hot and dry days because I know that will increase the Culex pipiens mosquitoes, a species, the vector for West Nile virus.
I think so.
Yeah.
I don't usually say that in the summertime. And there are certain people that are more likely to get West Nile virus or more likely to, I think, get really sick from West Nile virus. So if you're over the age of 55 or if you have weakened immune systems or, a young child or something like that, then you are more likely to have that kind of more severe illness. And there's really no specific medication to treat West Nile virus. So that's why the best way to prevent yourself from getting sick is to prevent those mosquito bites. And plus, they're no fun to have anyway.
No, they're not.
So I wanted to maybe change gears a little bit because there are other types of mosquitoes in the city that can cause other diseases. As you mentioned, a lot of the mosquitoes that are around are actually these nuisance mosquitoes, and they don't get us sick. But there are other types of mosquitoes too. And I think, one thing I was surprised about seeing last year, so I look at the human surveillance data. That means I track the number of people who get sick with different diseases. And one of the things I was surprised to see that there are about 3 times as many people in Chicago who were diagnosed with dengue virus infections in Chicago last year compared to West Nile virus. Now, all of those people had traveled to somewhere else. So they weren't picking up their infections here in Chicago. But from what I understand, it's actually a different type of mosquito that carries the dengue virus. And I was wondering if you could maybe mention a little bit about those mosquitoes.
And this is why we're continuously tracking. In our traps, we make sure to identify every species of mosquito that comes in. Why? Because we're looking for that mosquito that transmits dengue or any other diseases, any new mosquitoes, but specifically for that one is this Aedes aegypti mosquito. And we do have her cousin, which is Aedes albopictus, which we didn't have years ago. When I first started, we weren't seeing Aedes albopictus. It's a tropical mosquito. They were said, don't worry about it. We have them all over the city of Chicago now, which gets me to think that in the future, we may be seeing more of this other species that can carry the dengue, Zika virus, and other viruses. So we are always on the lookout. But currently, we don't have that species of mosquitoes here. But we are constantly tracking and checking. But as, like you said, most of those cases have been all of them have been travel-related cases.
Yeah, so good news.
Yes.
We don't have this Aedes aegypti mosquito, and that is the one that really kind of spreads this dengue the best. We do have the cousin, which, maybe I'll be a little bit worried about, but it sounds like most people are okay here in terms of thinking about dengue virus, but it is something where if somebody is traveling. So last year, what we were seeing is that a lot of people traveling to Mexico, a lot of people in Chicago have family there or like to go there for vacation. Why not? Sounds wonderful. Or to places like Puerto Rico, same thing, even though part of the United States, obviously, but an area that does have this type of mosquito, the Caribbean, portions of Central and South America that have this type of mosquito. But really, I think it seems like it probably boils down to a similar thing, right? Where, this is a mosquito. This is something that's this disease is spread by a mosquito. And so you probably just want to prevent mosquito bites again, right? And even if you're traveling, there's probably no difference, right, in how you would actually prevent these mosquito bites.
Yeah. And I always recommend look on the website before you go anywhere and see what's going on. If they're having issues with dengue or any other mosquito-borne disease, the prevention's still the same. You want to make sure you're protecting yourself from the mosquito bites, that you're wearing repellent, and that you're aware of when they're most active. So if this happens to be a species that's active all day, then you want to make sure you're protected all day, not just at night, or reapplying if you are during the day. And I think that's just the key. Is repellent or protecting yourself by using repellent.
Still got to prevent those mosquito bites. It sounds like probably takes a little bit of planning ahead. So you got to pack your insect repellent or your protective clothing. You got to think about where you're staying. You might not be able to prevent there from being holes in the screens or something, but maybe there's a place with AC that you can stay. And then I think one of the key things on kind of thinking about your own health is like, okay, say you did the best you could. You still got bit by mosquitoes after you traveled. That happens, right?
Happens to the best of us.
Yeah. Then really, especially for dengue, you want to monitor yourself for any symptoms. And then actually you still want to keep preventing yourself from getting mosquito bites. And that is because if you did, unfortunately get sick with dengue virus, you then don't want a mosquito to bite you here and then potentially be able to spread it to somebody else when we don't really have it. So you want to do that for about 3 weeks. So you want to monitor your symptoms for 3 weeks. You want to keep preventing those mosquito bites for 3 weeks. You also don't want to get West Nile on top of it.
No.
So always good to prevent those mosquito bites. And then in terms of symptoms that we're actually worried about, it's things like a fever, headache, body aches. And, those are not always very specific. A rash can happen with dengue too. But if you are seeing them after you've traveled, I think it's always a good idea to talk to your healthcare provider, whoever that might be, and then make sure that you tell them that you traveled, because that is really kind of, I think, what has alarm bells ring for them about all of the different things that it could be, whether dengue or something else. And the reason I think I wanted to mention dengue, at least, is because more people tend to get sick when they have dengue. So, we talk about West Nile virus. We say about 8 in 10 people actually do not develop symptoms. It's a little bit different for dengue, where, 1 in 4 people get sick. So that's, a quarter of people get sick. And then severe infections actually can occur in 1 in 20 people. So quite a bit more than the 1 in 150 people for West Nile virus. And then also severe dengue really truly can be an emergency. And so it's one of those things where if you've traveled to an area, you've developed symptoms, and especially if you have certain symptoms like belly pain, frequent vomiting, bleeding that can occur, or you're feeling really down or really restless, then those are issues where I would say, okay, you really need to contact your healthcare provider right away. And so I think I just wanted to make sure that people were also aware of this. But as we said, key is truly preventing those mosquito bites.
Yes. And I know it can be difficult to do because I just got back from vacation and I got one. My friends got like 12, but I still got one. and I know all the tricks.
Well, one is definitely better than 12. So.
Yeah, they were. And everybody reacts different. They were very irritated and they had a rash where they had their mosquito bites. So, and everybody reacts differently. But as you mentioned, if you're not feeling well and you have a lot of mosquito bites, go call your doctor, go to urgent care. And if the symptoms are severe, go to the emergency room. It's better to be checked. And that's what we're trying to prevent. This tiny little mosquito can do so much damage, and we're so lucky that we're here in Chicago that we can do something about it and that we have a program that does something about it. There's a lot of cities and other countries that have no vector control, and they have a lot of people getting sick and dying. So I'm really happy and privileged to be here.
Yeah, I mean, you do wonderful work. I have just one last question for you. So if there's someone like a student that's listening to this and like you is like, ooh, mosquitoes, love to talk about those.
Yeah, we're out there.
Or they think your job sounds really fascinating. Are there opportunities for them to work with CDPH? Or
Absolutely. Through CDPH and or our contractor, if they go on the city website, they're able to find these internships for students that are interested in the sciences, environmental health, through the city website. And every summer we host at least 12 college interns, and we love doing it. And we're always looking for kids that are interested in. Because it helps if you like it. It really does. And
there are people out there that love mosquitoes.
Yes, I've actually met so many that I'm like, oh, okay, yeah. But definitely through the city website, they'll direct you to me, and I will be able to either direct you through us or through our contractor.
Okay, that's wonderful. Thank you. And then really, I just want to thank you so much for your time, Claudia. As you said, mosquitoes are a little thing, and I think people often ignore them, but they really can cause people to get quite sick. And it's really thanks to you and your program that we're trying to prevent those mosquitoes from making people sick. So always a pleasure to see you, and I will let you go deal with the mosquitoes.
Thank you.
All right, thanks so much.